Hello everybody, and welcome to my second video on surgical instruments, and this time you'll have a little bit of commentary to go with it. So let's go straight in and have a look. So first off we have our Kilner needle holder and a Spencer Wells dressing forceps. There are two of those. I think there'll be more somewhere in here. Oh yep, there's another one. Then we have our Norfolk and Norwich retractor and our dithermy lead. There we go. We have a Babcock's forceps, two of those, and our bag clip, which is just used for clipping a bag onto the side of the table so they can put the rubbish into it. And we have our Weightlander retractor, a smaller version of the Norfolk and Norwich. And some Babcocks, some more Babcocks there really. And we have our Crylewood needle holder and an Alice an Alice dressing forceps. There should be another one somewhere. We have our BP handles, which are a bit wet. I'll dry them later. As if I'm holding scalpel blades to make the incisions. This is a Morris retractor, another Crylewood needle holder there, and our Mayo needle holder, which is slightly more heavy duty. Used for suture, by the way, in case you're wondering. Our Langenbeck retractors are the medium size. They come in large, medium and small. These are the medium ones. Similar to the Morris, as you can see. These are more of our Cryle's forceps. More and just add them. And here is our Bland Sutton forceps. And the difference between the dressing forceps, which is what these are, and the tissue forceps, as you'll see later on. There's a lot more of the dressing forceps involved. Don't ask me what they do, because I'm not really into viewing the operations myself. And here we have our dithermy forceps, which clicks on here, as you can see. Used for cauterizing. That much I do know. And our Ramply sponge holders coming up. And here we go. Ramply sponge holders used for swabbing with iodine. A Lane's forceps. Another Bland Sutton there. Another Ramply. And here are our smaller Langenbeck retractors. Here we have our towel clips. And it's important for me to point out here at this point that a lot of people mentioned in my last video that I was clicking onto the ratchets. That's what that sound is that you can hear just now there. And they were complaining basically. The idea is that you put them on the first ratchet to prevent heat cracks in the joints. However, people didn't seem to see that. They think it affects sterility, but sterility isn't affected on the first click of the ratchet. That's what we're taught, and that's what we go by. And we have some Spencer Wells, some more Spencer Wells there. I'm going to put them on the same pile in case it all falls off. So yeah, also need to point out here that the names may be slightly different to what you know if you're in this industry. Names vary from hospital to hospital. I know I've worked in several hospitals, so. And here we have a standard scissor. have our Makindo scissor. You see, slightly longer, a bit finer. Have a curved Mayo scissor. And our regular Mayo scissor. Another Spencer well there. Another Lanes. Another Spencer Wells. I believe that's a strabismus scissor. I don't have the sheet in front of me, so I'm not 100% sure. I will in a minute. Some more Lanes. I only recognise some of the instruments. Got a terrible memory, unfortunately. Another instrument bin, there's 3 of those now. We just thread their instruments onto those bins to keep them in order. Another BP handle. They're usually numbered. Here we are. These are our tissue forceps. You can see the difference. They look like tweezers. And this is a DeBakey's, as you can see. By the groove on the inside is slightly different to others. We're just looking at, here we go. Look, there's groove slightly different as it runs along rather than across. This is a Bonnie's Toothed. Quite a heavy, nasty bit of kit there with the teeth. There, you can imagine what they do. Next up we have our Makindo, sorry, pronounced that correctly, named after a famous surgeon from the Second World War who pioneered plastic surgery techniques. A plain forceps there. And this is a Gillies, I believe. Can't quite see the teeth there, the camera won't focus, but they are there, trust me. And another one, another set there. Another toothed Gillies. And a regular planed forceps, I believe. So now I need our printout, which has just printed. So I'm not going to let you see that though. And now we need to get our tray, mesh tray, and tray liner. That's what this is. Tray liner, crepe paper there basically to absorb moisture when it goes through the autoclave. So let's get a lint-free paper towel. Dry off the tray because there's a bit of moisture from the washer. And some people point out that if there's any moisture left from the washer that it should be reprocessed, but again it's been proven that as long as the conditions in our clean room are kept clean, bacteria shouldn't spread too far and anything left over will be killed off by an autoclave, which kills everything apart from Creutzfeldt-Jakob disease, I believe, which only affects the ear, nose and throat. British government decided in their haste to destroy all ear, nose and throat instruments after use to prevent the spread of Creutzfeldt-Jakob disease. However, that proved very costly. So now we have to go by the check sheet in the order of instruments, place them into the tray so that the theatre assistants can pass them to the surgeon as requested and required. So we put them in nice and neat and orderly. They like to have their towel clips like this for some reason, don't know why. In pairs of three, in groups of 3. Just use that printer there, making a bit of sound. So I get 3 of those, don't know why they need 3, but anyhow. So again, yes, I'd just like to reiterate the point I made earlier about putting them on the first ratchet. If you don't like what I'm doing, then unfortunately it's not my choice. This is what I have been requested to do by the people who have trained me to do this job. And as I say, I have worked in several different hospitals and several different departments. and all of them have taught me to use this method of just using the first click on the ratchet, no more. No more than the first click, because then yes, it does affect sterility, but on the first click there isn't enough pressure on the jaws to affect steam penetration. So that's what I do, that's what I've been shown to do, and if you've been shown to do different, then I'm sorry, but we can't really discuss it any further than that. That's just the way things are. If you have a complaint about the way I do things, then take it up with someone else. Okay. Well, I hope you've enjoyed this look into the world of surgical instruments, and I hope to see you in another time. Thanks for now. Bye bye.